Hi, my name is Carla Nicole Guevara Davalos. My topic is community-wide screening for tuberculosis in a high-prevalence settings. Definition: tuberculosis is a communicable chronic bacterial infectious disease generally produced by M. tuberculosis, although it can occasionally be produced by other mycobacteria, the most common being M. bovis and tuberculosis.
What is TB? TB is a curable disease but is still a problem in Singapore. Tuberculosis. TB is a dangerous and infectious disease caused by bacteria. It usually attacks the lungs but can affect other parts of your body as well. TB is hard to tackle mainly because it spreads through the air. When a person with active TB disease in his or her lungs coughs or sneezes, the bacteria are released and can stay airborne for several hours. Those who breathe in the bacteria may then become infected. Thus, TB usually spreads to people who live or work closely together with an untreated, infectious patient with active TB disease. Most people infected with the bacteria remain well, but have latent TB infection. This is a condition where the TB bacteria are kept under control by the person's immune system. People with latent TB infection do not feel sick and do not spread the germs to others. But when the bacteria cannot be kept under control by the immune system, the infection progresses to active TB disease. A healthy person who is infected has a 10% chance of developing active TB disease in his or her lifetime. The highest risk period is within the first 2 years of being infected. A person with a weak immune system has a higher chance of progressing to active TB disease. This can happen if you have certain illnesses or if you're taking medication that suppresses the immune system. Symptoms of active TB disease include coughing for more than 3 weeks, coughing out blood, loss of appetite and weight, tiredness, fever and night sweats, and chest pain. When you are diagnosed with TB, you'll be treated with a combination of drugs for 6 to 9 months. As TB patients, you will be treated under the Ministry of Health's Directly Observed Therapy Program, which focuses on adherence to treatment until completion. This is important to cure TB and prevent its transmission in the community. DOT is a program where patients take each and every dose of medication under direct supervision at a polyclinic or at Tan Tock Seng Hospital's TB control unit. This ensures that patients take the correct dosage and combination of drugs and complete the entire course of the treatment. Side effects are also closely monitored. While the medications are safe, some patients may experience side effects such as nausea, loss of appetite, giddiness, fever, jaundice, and skin rashes. If you have any of these side effects, please inform your nurse or doctor immediately. Orange-colored urine is a harmless side effect. Once you are no longer on the medications, the appearance of your urine will be back to normal. Please do not be alarmed. More than 95% of patients are completely cured if they take their medications correctly. Although you will feel better within the first few weeks, you must still complete the full course of medicine as prescribed. Otherwise, the bacteria may become resistant and TB may recur. Drug-resistant TB is extremely difficult to treat because the medications used to treat drug-resistant TB are less effective against these strong TB germs. These medications have to be taken for a longer period. These medications have more side effects. Moreover, the chances of a complete cure are considerably reduced. If you have active TB disease, help keep your family and friends safe from the disease by staying at home in the first 2 weeks of treatment, covering your mouth with a tissue when you cough or sneeze, completing the full course of your TB medications faithfully as prescribed, and providing the contact details of those whom you've had close contact with, so that they can be tested for TB. For more information, contact the TB Control Unit or speak to your doctor today.
Application in medicine. Diagnosis requires a tuberculin skin test, mountain test, or blood test, checks X-ray, and examination and culture of a sputum spleen. Early diagnosis and treatment, along with isolating people with active disease until they respond to treatment, help prevent the spread of tuberculosis. Pros and cons. Pros: Stop the spread of infections, restrict the infections as soon as possible before it becomes an activity site, sometimes vaccination. Cons: People at high risk for TB disease fall into these two categories: people who have recently been infections with tuberculosis bacteria and people with conditions that weaken the immune system. Approximately 5 and 10% of infected people who do not receive treatment for latent TB in people with weak immune systems.
Importance. TB gets into the alveoli, where macrophages phagocytose them. Usually, with most pathogens, macrophages would package them in phagosomes and fuse them with lysosomes, which would break it down, but that is not possible because of its various virulence factors. So, what happens instead is that TB starts to grow inside the macrophage. Eventually, it will kill the macrophage and it will spill TB into the lung. Few weeks later, the cell-mediated immunity kicks in, which is a Th1 response. CD4 T cells get activated and release of interferon gamma happens. Macrophages and cytotoxic T lymphocytes also get activated. Something else you must keep in mind is that this is a type 4 hypersensitivity reaction. All of this leads to formation of a granuloma, which essentially is an attempt of the immunity system to wall off the bacteria and prevent it from spreading. The tissue in the middle dies, leading to something called a caseating necrosis, or cheese-like necrosis. This is pretty disgusting. This area is known as the gone focus. These are usually subpleural and can be found in the mid to lower lobes of the lungs. TB can reach the nearby hilar lymph nodes as well, and cause caseating necrosis there. So, the association of the lymph node with the caseating tissue is known as gone complex. The gone complex can undergo fibrosis and calcification, and often produce a scar tissue. This calcified gone complex is known as Ranke complex. Now, there are two scenarios that can happen. Either the immune system is finally able to kill off the Mycobacterium tuberculosis, and that's the end of the story, or the mycobacteria remain viable. Even though they're walled off, they just remain dormant. This is known as latent TB. When the person's immune system gets compromised, like in HIV, the latent infection can then become reactivated and start to spread around. This is known as reactivated TB. For that reason, giving patients certain immunosuppressant drugs should be preceded by a TB test to make sure that the patient is free of TB. As the immune system has been previously exposed to TB, memory T cells quickly release cytokines trying to contain the spread, and this leads to more areas of caseating necrosis. This time, however, it tends to cavitate, which can lead to disseminated spread of bacteria. It can also spread through the lymphatics to other parts of the lungs and can lead to bronchopneumonia. Spread through the vascular system is also possible, which leads to infection of other tissues in the body. This is known as miliary TB. Nearly any organ system can be involved in it. It can lead to meningitis if it spreads to the CNS, and can cause pericarditis if it spreads to the heart. Important clinical correlation to keep in mind is that if TB spreads to the spine, it can cause something called Pott's disease. Another association to keep in mind is that pulmonary TB is related to aspergilloma. Moving on to clinical signs and symptoms of TB. Primary TB is usually asymptomatic, but leads to a positive PBT test. It happens mainly in people who have an ineffective immune response, like kids and patients undergoing chemotherapy. TB has a triad of symptoms: fever, night sweats, and weight loss. In addition to that, patients can have cough with blood, this is known as hemoptysis, and pleuritic chest pain, which is chest pain while breathing. They also have fatigue and arthralgia. Hilar lymphadenopathy is also a very early sign of TB, which usually occurs in the first week of infection, and it takes months to years for it to resolve. Reactivated TB can also present with cough, weight loss, fatigue, fever, night sweats, and hemoptysis. Now, time for another flash quiz. What type of response causes the production of a GON focus? That's correct, Th1 response. Mycobacterium tuberculosis grows slowly. Because growth is so slow, cultures for clinical specimens must be held for 6 to 8 weeks before being recorded as negative. They need a special medium to grow called Lewinstein-Jensen medium. Diagnosis is usually made through the tuberculin skin test, also known as TST. It's done through a subcutaneous injection of purified protein derivative. The diagnosis is made on the basis of the diameter of the resulting induration. QuantiFERON TB Gold test is a new test for TB, and it has a very high specificity and sensitivity, and thus is considered the gold standard test for latent TB. So for the diagnosis, after screening with either TST or QuantiFERON, if they come back as positive, we can proceed with a chest X-ray. If it has suggestive findings of TB, then the confirmatory test would be a sputum sample to stain for acid-fast bacilli. Active patients require a multi-drug regimen, which includes RIPE, which stands for rifampin, isoniazid, pyrazinamide, and ethambutol. Patients with latent TB can be given isoniazid as monotherapy. After we've discussed everything regarding TB, now we're going to talk about how we can prevent it. Better housing and nutrition can decrease your chances of getting TB. The infection spread can be reduced with prompt identification and adequate treatment of patients, and also with using masks and other respiratory isolation procedures, specifically among the medical personnel. Lastly, there is a vaccine for TB known as BCG vaccine. It's a live attenuated vaccine containing a strain of Mycobacterium bovis. It's used primarily in areas of the world where the incidence of the disease is high. However, it's not usually used in the United States because of its variable effectiveness, as it only induces partial resistance to the organism, and because the incidence of the disease is low there. Alright, to sum it up, today we talked about TB. Remember the letter M. It has a cell wall made of mycolic acid, remember acid-fast. It infects macrophages, so it's intracellular, and it leads to granulomatous reaction. And finally, active TB is treated with multi-drug regimen, while latent TB is treated with isoniazid monotherapy. And that's it for TB. We hope you enjoyed the video. Please let us know what you think about the new flash quiz part, and what do you like or dislike about this video. Don't forget to like, share, and subscribe to receive our latest explanations. And as always, thanks for watching.
Issue, issue applied in Ecuador. In the year 2015, the estimate of the World Health Organization for Ecuador was 8,400 new cases of TB, 51.6 102,000 inhabitants, include those with TB and HIV co-infections. And conclusion, in conclusion, we found that annual community-wide TB screening in an area where TB is endemic was more effective than standard passive case screening alone in reducing the prevalence of TB in the population. Thank you.